A warm welcome to this video. Now, as we move into the fall, the autumn time, cases in the United States are increasing, but deaths don't seem to be following suit. Death seems to be going down slightly, if anything. But there's no question that this fall and winter is going to be a difficult time before vaccines and other measures come in. This is going to be really the pivotal part of the pandemic. The last March, April, May time was a bit of a dress rehearsal for what we're going into now, I am afraid. So I wanted to sort of take a bit of stock of the situation in the United States, where we're at now, and then think about where we're going. So let's just start off with Kamala Harris. You might recognise the name. Now, she's tested negative despite being exposed. So she says she's isolating as an abundance of caution. But as far as I understand it, according to the Centre for Disease Control criteria, she should self-isolate for 10 days. But I'm not quite sure what's going to happen there. I think the rationale is that they're doing lots of testing so they don't have to isolate for 10 days. But as far as I understand it from the CDC, the rest of us should isolate for 10 days. So it'd be interesting to see what happens there in that particular case. Now, US current cases. Last 24 hours, there's been another 60,000 officially diagnosed cases. Now, these cases are people that have been officially swabbed for the antigen and officially diagnosed as having the antigen. And the accumulative number of cases in the United States now, to take stock a little bit, is 2,386 cases per 100,000. And of course, that works out at 2.38, basically 2.4%. So what this is saying, and it's quite a profound statement really, 2.4% of the American population have been tested positive. The real number is obviously way higher than that, but that's the number that actually been tested. So about 2.4% of the population tested positive already. 100 plus 53,120 per day over the past 7 days. So that was the number of new cases in the past 24 hours. This is the average number of new cases per 24 hours over the past 7 days. And this is clearly an increase in where we have been. In fact, this it said here, this is from the Centre for Disease Control, representing a 23% increase over the past 2 weeks. So 23% increase over the past 2 weeks, quite significant. Now, we know there's always a delay between people getting infected and people getting very sick and people dying. But even accounting for that, the direction of death rate in the United States is surprisingly promising. And this is the graph here. So we see the numbers up here. That's 1,000. That's 2,000. That's 3,000 per day. So we did have a bad time here in April. Then things went down, then up again. But now, for quite some time now, really since the end of July here, the trend has definitely been downwards. So, you know, making a kind of a best fit line there, that trajectory is downwards at the moment. Let's hope that let's hope it drops off more steeply than that. But you know, can we realistically hope for this ongoing downward trajectory? I think it's quite possible that we can, because so much more testing has been done now. I'm not saying the testing is where it should be, but so much more testing has been done now that the infection fatality rate is appearing lower. But this is overall number of deaths. Overall number of deaths are still apparently on a downward, or are on a downward trajectory. So I do find that encouraging. We had feared for much worse than this. It's now still appalling, of course. It's still a tragedy, but it's slightly better than personally I had feared, I must say. Last 24 hours, 1,009 new deaths. So these are deaths attributable to COVID-19. 216,000 attributable. But the problem is, and this is illustrated here by the United States, but it's the same everywhere, the real number of deaths is much higher. partly because people die of COVID that's not diagnosed, but also because of what I've been calling, and it's an appalling expression, but I can't really think of a better one, collateral deaths. People that are dying as a result of unwillingness to access healthcare facilities, or inability to access healthcare facilities because they're all crammed with patients with COVID-19, or the other adverse effects on health that can lead to death that have been caused by the measures that we've taken to try and contain the pandemic. So there's lots of other ways that this can be problematic, and that can be expressed in the total number of excess deaths. Now in the US, the excess deaths, check it out, CDC, 266,000 more than normal. So we can see that's a fair bit more than the official number of COVID deaths. So quite a few people have died more than normal this year, more than the average in this year. And we have to assume this is because of the pandemic, but not all directly caused by the pandemic. Some will be undiagnosed, but many are the collateral damage because of the disruption caused by the pandemic. Now that is September data, so that's out of date. Now this is up to date. That's yesterday's figure, 216,000. Well, that's from the website this morning. I've just taken that figure. But that figure there is clearly out of date, so that figure there could easily be 300,000 now. So we need to think not just about the deaths caused by the pandemic itself, but all the other deaths. Not to mention all the other suffering that's associated with the pandemic. This whole situation is a bit of it's been a very unfortunate situation that this pandemic happened, really. Adverse effects on so many people. So that's deaths from all causes, and they've increased everywhere except Alaska and Hawaii. So there's excess deaths in all American states except Alaska and Hawaii. Now, the pandemic has really carved a bit of a swathe across the United States. And I just want to take a bit of a cross-section of that. Now, one is fairly obvious one, universities. This is largely from the New York Times, this information, but it is available in other places. 178,000 cases in universities. That's students and employees. That is a lot of new cases. And of course, we anticipated this on this channel, and many others, of course, anticipated this weeks ago. This is really quite inevitable that this was going to happen. And yet, it surprises me that, the United States was talking about very advanced online education years ago when I was doing some studies into this myself. And, the fact that the United States wasn't ready just to click into more online education, I must say, surprises me. There's probably financial and other reasons going on as well, but anyway, whatever the reason, people have been attending universities, and 178,000, that's the minimum number, have been infected. That's the diagnosed number. The real number, of course, will be higher. 1,400 institutions. Unfortunately, there's been 70 deaths, but 68 of those deaths were amongst staff. Thankfully, only 2 were amongst students. Now, I've emphasised this many times. We've been fortunate with this virus that it doesn't tend to kill younger people. It can do, but it's less likely to do so. This is not like the 1918 pandemic. It's not like Ebola. It's not like the Middle East respiratory syndrome. In many ways, we've been a bit lucky. 2 students have tragically died. But out of well, we don't know how many students, that's students and staff. We can probably assume more than 150,000 students have been infected, and 2 deaths so far this fall. So we remember the lives of those 2 students, but of course the number is relatively small. Now, jails and prisons. We talked about this back in January, because there was a couple of prisons in China where there was outbreaks in prisons and a lot of inmates were infected, and we believe there were deaths, although we're not sure about the data there. And we anticipated that this would be the case. We've always on this channel flagged up the danger of institutional transmission, and unfortunately that has come to pass. So in the United States, 233,000 cases in prisons and jails, and 1,372 inmates and staff, mostly inmates, have died, unfortunately, meaning that these places were not safe, I guess. Now, some institutions have been particularly badly affected. St Quentin's not the top of the list, but St Quentin, for example, St Quentin, of course, everyone knows about that in the UK from Johnny Cash, of course. But in St Quentin, 2,500 infections diagnosed, 29 deaths. Now, Mr. Chan is an inmate in St Quentin, and these are direct quotes from Mr. Chan. "I'm very concerned, obviously. There's no way to socially distance. No way to socially distance. Obvious factor. We all eat together. We have a communal bathroom." Ticking these for significant risk factors. "There's no way to address a public health issue in an overcrowded facility." I mean, this is guaranteed mass transmission of the virus, isn't it? There's no two ways about that. And I also really wonder how much access prisoners in the United States have to the sunshine, particularly in the northern states, I would imagine. So I do suspect that vitamin D status is probably very low in American prisons, and that would be very easy to correct if the authorities chose to do so, but I've never heard that they have chosen to do so, which is a pity. Nursing homes and care facilities, of course. Facilities, 21,000 different homes, facilities, units have been suffered infections. Well over 500,000 residents and employees have been officially diagnosed. 532,000. 83,000, dear me. 83,000 deaths. 35% of the total deaths in the United States. Now, I'm not singling the United States out here. The same happened in the UK, same happened in France, same happened in Italy, same happened in quite a few countries. Sweden, of course, had a deliberate policy of not transferring people into hospital. It's not I'm not picking on the United States here by any means, but it is a sad reflection on the world that we have completely failed to protect so many of these highly vulnerable people. For example, this doctor, Chief Medical Officer, Indiana State Social Services, Dr. Daniel Rasinka, probably pronounced it wrong, sorry doctor. Chief Medical Officer, right, "This disease creates the potential for a perfect storm in a long-term care facility." Direct quote. "Large groups of vulnerable people living together in a highly transmissible virus." This virus is highly transmissible. We sometimes forget to remind ourselves of that. A virus that may not cause any symptoms in those who care for them. So this has been particularly a problem when people work at more than one facility. Infections carried from one to the other. The employee, who may be very young, feeling fine, but transmitting the virus. And we've seen the effects. Now, another taking stock sort of situation in the United States is food production facilities. Now, we've looked at this a couple of times. Very often they're indoor, there's no sunlight. Very often people are working in production lines, they're very close together. Very often there's a lot of mechanical noise, so when people want to talk to each other, they've got to shout. Very often people are migrating to work there from another country or another part of the United States. So they all tend to live in the cheapest accommodation they can find, which is often a lot of people crammed together in one house. They often travel to work together, shared cars, buses, things like that. Pretty well guaranteed spread of the disease, really, and that's exactly what happened. But only 28 states are providing data to the Centre for Disease Control on this. So most, well, not most, but a lot of the states not providing data to the CDC, only 28 states. And not all facilities are submitting reports to the CDC. Some people are probably trying to keep it on the QT rather than talking about it. But despite these limitations in data, 16,000 cases or more, 86 deaths. So these are absolute minimum figures, and of course that's only for 28 states, and it's not all of the food processing facilities in those 28 states. Large outbreaks have also emerged on farms, fruit and vegetable processing facilities, pet food plants. So we could have mentioned cruise ships, we could have mentioned military facilities, military ships, there's other things we could have mentioned that are clusters in the United States. Now, going on to the states themselves, Wisconsin, for example, cases have quadrupled in the past month, ×4 in the past month. This is a dramatic increase. Hospitalizations more than doubled during September. Test positivity rate 19.6%. So what this means is basically a fifth of all the tests being done are coming back positive. This means there is a lot of community spread going on in Wisconsin. A significant amount of community spread. That's a very high positivity rate, and to me that basically guarantees that cases are going to carry on increasing in Wisconsin and indeed other states with these high positivity rates, bearing in mind the World Health Organization says that the positivity rate should be below 5% for 2 weeks before reopening measures take place, and yet this is simply not being abided to by many states. Just a few examples here. These are the highest states, obviously. Idaho, positivity rate 24%, South Dakota 19.5%. These are remarkably high. This is not what we want to be seeing, but these are accurate figures. Iowa 17%, Nevada 15%, Kansas 15%, or way, way above the 5%. Way, way above the 5%. Utah 14%, Wyoming 14%, Alabama 13.8%. Indiana, Nebraska, Florida. Nebraska 12.2%, Florida 10.2%. These are very high positivity rates, and of course in a state like Florida, which is a highly populated state, that represents a lot of people, a lot of cases. Now finally, on the United States, this is a bit strange. I've been watching news reports, obviously, from different channels in the States, and it appears that hospitals are starting to be quite significantly stretched in many states. I mean, we know, for example, in it was in Wisconsin, wasn't it? There was an emergency hospital reopened. So we're seeing a lot of what you might call, well, it's not anecdotal evidence, it's video evidence of hospitals struggling, intensive care facilities struggling. Yet this is the graph from the Centers for Disease Control on hospitalizations. Now, I took this off this morning. These lines represent different age groups. So obviously the higher group are the elder group, the younger group, younger group, younger group. This data is as of the 3rd of October. And it's basically showing that the levels of hospitalization are the lowest they've been all the way through back since March. So there does seem to be a kind of inconsistency between these official figures. Okay, this is always hopelessly out of date. This is for the 3rd of October. We've moved on a bit now, obviously. But still, there does seem to be an inconsistency between this official Centers for Disease Control published data and what we're seeing from video evidence around the country. I don't pretend to be able to explain that. I would imagine we're going to see an increase, unfortunately, in the next month's data. But even accounting for the lag, that doesn't quite make a lot of sense. So that's all I'm going to say about the United States at the moment. So cases are going to carry on increasing in the United States over this fall and winter. It's not gone away yet. We don't know what proportion of the population of the United States has been infected, therefore we believe has some degree of immunity. It could be as high as 15% now, but that still leaves a lot of people still vulnerable to the disease. Fall and winter, we don't need to go through this again really, but vitamin D levels are going down because of the sun. People are closing the doors and the windows because it's too cold outside. People don't want to eat outside, they want to eat inside. People becoming closer together. People putting on the heating. The virus can survive probably best at 5 degrees centigrade, but the thing about the heating is it often reduces the humidity, and the virus spreads better in indoor low humidity. We know the virus is spread by droplet infection, by aerosolization, by talking. So any indoor environment where more than one household mix is going to be a transmission risk. Mask wearing is not universal in the United States. It needs to be. Social distancing is not universal. It needs to be. Hand hygiene is not universal. It needs to be. Good ventilation is not universal. By any means, it needs to be. Therefore, cases are going to increase over the next month or 2 or even 3 in the United States. The big hope is that the death rate doesn't follow. And there's early indications that this may be the case. But as of now, we don't know what the death rate is going to be. It's going to rise, but we hope the rate of rise is going to decrease. So that is roughly where we seem to be, where we've been in the United States, and unfortunately where we're going for the next few months. Next year, this time next year, it will be a lot better. I have no doubt at all. But in Dr. Fauci's words, hunker down for the fall. Thank you for watching, as always, of course.